Okay, we'll go ahead and get started. Good morning, good afternoon, good evening, everyone. Welcome to International Medical Corps' final global briefing of 2024 and a look ahead to next year. I'm Rebecca Milner, International Medical Corps Chief Advancement Officer. I just want to say thank you so much for joining us today. Really know that it's a busy time and really appreciate you taking time out of your schedules to join us. And want to also thank you for your support over the past year. We're really grateful for your commitment to our work. As we always try to do, we're going to keep today's briefing as efficient as possible. We'll wrap up in about 45 minutes. So toward the end of our conversation, we'll take a few questions. So as we talk, please feel free to type your questions in the Zoom Q&A, and we'll do our best to get to them. As you can all imagine, this year was as challenging as ever. And as we saw this past weekend with Syria, circumstances in the humanitarian business can change quite rapidly. And in fact, there were really no shortage of humanitarian crises across the globe this past year, whether it was the war in Gaza that has now expanded to other countries in the Middle East, to the war in Ukraine, to disease outbreaks in the Democratic Republic of Congo, to famine in parts of Sudan, and then also a devastating hurricane season right here along the eastern seaboard in the US. And those are just a few highlights from the past year. And really, it's a perfect storm of a series of interconnected challenges that's driving humanitarian need across the world. The elements of this perfect storm are threefold. One, conflict. Expanding conflicts in Europe, the Middle East, and Africa are incredibly destabilizing. Two, climate-related crises. We've all seen how the hurricane season has gotten a lot worse in recent years. Significant flooding and catastrophic flooding across a number of countries this year. And then, drought, paradoxically, as well. And three, communicable diseases. Diseases that we know, like measles and cholera, and emerging infectious diseases that we don't know anything about. All of these this perfect storm is driving kind of record humanitarian need across the world. And today we'll get an update on how these interconnected challenges continue to unfold and discuss what we might expect in the months to come. I'm very happy to welcome three of my incredible colleagues. We have Paula Olsen, Dr. Abdu Sebashishi, and Erica Tavares with us today. Just quick introductions of everyone. Paula Olsen, she directs International Medical Corps programs in 11 countries across West, Central, and Southern Africa, as well as Latin America. And it's always great to get Paula's insights. Dr. Abdu is a senior global health technical advisor focusing on Africa and the Middle East. Dr. Abdu himself was internally displaced as a child in the Democratic Republic of Congo, and he's dedicated 12 years of his career to humanitarian work. And we also have our colleague, Erica Tavares. Erica is one of our senior directors of program, leading our response operations here in the United States and territories, and she oversees a portfolio of global programming aimed at building the capacity of local and community-based organizations. Welcome to everyone. Thank you so much for joining us, and thanks for your insights today. I'm going to start with you, Dr. Abdu. Each year brings record numbers of people forcibly displaced from their homes. In 2024, that number reached a staggering 123 million. Obviously, a stark example of this is in Gaza and now in Lebanon and Syria. Can you describe for us what the situation is like for families on the move in the Middle East and how we're responding?
Thanks, Rebecca. Thanks for having me today. We are indeed living through times of deep uncertainty in the region. Families on the move are in dire situation, facing a lack of adequate shelter, food, medical care, and are struggling to meet their basic needs. Winter just amplifies these challenges. The overcrowding conditions of shelters or camps increases the risk of waterborne disease like cholera, given the often compromised sanitation systems in these settings. For those with chronic disease, those displaced with chronic disease, such as asthma or heart disease. The cold weather worsen their symptoms while they are facing issues accessing their regular medications. The combination of exposure to cold, increased disease transmission, and limited access to healthcare is leading to higher mortality and morbidity rate among displaced families. You've got also the issue of malnutrition due to the shortage of clean water and food, which weakens the immune system, making people, especially children, pregnant and lactating mothers, more exposed to illnesses. We've got also mental issues, mental health issues, the psychological stress of displacement combined with harsh winter condition often lead to depression, anxiety, and PTSD in most of the time, which impact the overall physical health as well. Not to mention accidents from slippery condition that are really hazard, especially for the elderly and those with mobility issues. Now, in the middle of all this, International Medical Corps comprehensive approach is aim to address both the immediate and the long-term needs of to help these families on the move, to help them survive, but also rebuild their lives in the middle of the ongoing conflict. Of course, the safety and security of our staff are our top priority. But as we can, our team and partners in Syria, Lebanon, and Gaza are continuing their work adapting to the ever-changing circumstances. We provide primary health care package, including sexual and reproductive health to this family in move, as well as mental health and psychosocial support. We also ensure that they have adequate sanitation, but also clean water is provided in those shelters. We work with affected community to ensure that prevention of disease and continuation of care for those with chronic conditions is made available. Moreover, we offer protection for vulnerable groups, especially women and children. Specifically in Gaza, our field hospitals continue to see hundreds of patients daily. In Lebanon, our teams have scaled up their operations since the escalation of conflict there, offering mobile medical services and health support in shelters directly. And in Syria, our team and partners are already on the ground. They do provide healthcare services, especially that the health infrastructure there is under severe strain, with many facilities damaged and non-functional due to understaffing. This leads to a reduced capacity to respond to any new health crisis, and International Medical Corps stand with them and they're ready to assist these families on the move and their host community wherever they are.
Yeah, well, you mentioned the safety and security of our staff. I mean, we have probably about 2,000 to 2,500 staff across the region there, and they're doing incredible work every day. And you talk about the kind of intervention strategies. I mean, we work through both fixed and mobile facilities across the region, right? And you talk about, immediate needs. I mean, that's certainly something that we do with the mobile medical teams and services that we're offering from the fixed facilities. But maybe you could talk a little bit about sort of the medium-term strategies where we're trying to, while we're responding to immediate needs, but we're trying to bolster the health system as it exists through training, rehabilitation. Maybe you could give us some examples of that work.
Absolutely. So while we address the immediate need, we have in the back of our mind that we need to help the community to build their resilience after the crisis has happened. So we ensure that we work with the community, train key members of the community, train them to train others, build their capacity in different areas based on the assessments that we conduct within community to identify what particular area need some capacity building. So we do provide regular capacity building to community members. We also have a huge pool of community health workers that we do provide training so that they are able to reach even those areas that are difficult to be reached because they are member of those community. And we support them with supportive supervision on regular basis to ensure that the training that they receive are really applicable in their context. We also receive their feedback always and get their participation in designing future plans so that they are quite adapted to their context, but also help them to build their resilience in the future. A practical example, for example, in Syria and Lebanon, we help community to build health facilities that are actually climate change proof. So we identify areas that are not really affected, for example, by flood and so on, and we help them to build facility there, providing solarization to ensure that we have reliable energy that, sensitive to climate change. We do support in some areas building the capacity of midwife in many areas where we don't have the basic sexual reproductive health practitioners, and we do train informal training, but also on-the-job training that is being provided to various members of the community so that they are able to withstand the shock and respond also to future shocks and stress that affect their community on a regular basis.
That's a really helpful kind of overview of our approach. I mean, Paula, let me turn to you and your region. One of the largest humanitarian crises in the world that's getting very little attention is the conflict, displacement, and famine that's unfolding in Sudan and how it's spilling over into a broad regional conflict. Just in Sudan itself, more than 25 million people are in need of urgent health and nutrition services. I mean, maybe you can tell us a little bit about what's happening inside Sudan, but also across the region and how it's impacting just so many people.
Right, and happy to be here. Again, thank you for inviting me to come speak about this very important topic. And as you said, Rebecca, I mean, this is one of the most extreme, I think, conflicts that we're facing on the continent right now. And if you look at Sudan, Sudan is one of the largest countries on the continent of Africa, third only to Algeria and the DRC, which, as Dr. Abdu explained, is also facing intensive conflict. And so when you look at where it's placed and the potential for that spillover, we're really talking about the potential to destabilize a massive amount of the continent from the Sahel all the way to the Red Sea. So in every direction, the crisis in Sudan has a huge impact on the continent. It's been 16 months since the conflict began on April 15th, 2023. And as you mentioned, the statistics vary, but we're looking at 25 to 27 million people in deep and dire humanitarian need. 24 million of those are children. It's estimated at over 3 million have crossed borders into neighboring countries, 650,000 of those in South Sudan, which has also had its own conflict. And according to the UN, this war has triggered the world's worst hunger crisis. So we're talking about millions of Sudanese people dealing with emergency levels of hunger. If you also think about what Sudan means for the continent and particularly for this region, Sudan has been a huge driver or economic hub for the region. So it provides goods and services as an entry point for the rest of the region. So when you look at the destabilization of a country like Sudan in this context, you're also looking at massive amounts of inflation across the regional context and then internationally. So we're seeing rates of inflation higher than they've ever been in some of the countries that have this economic connection to Sudan. And so when we take all of that into perspective, knowing that this conflict has massive amounts of killing, atrocities that are underreported, these levels of hunger, it's really a huge concern for International Medical Corps and other humanitarian actors. You know, the model, many of you know International Medical Corps' model, which we're very proud of, the level at which we work with our national staff, with communities that we serve. And what was, I think, almost a saving grace of being a first responder in this instance is that while we were evacuating international staff, we had national staff capable and resilient enough to start dealing with some of the pressures that happened, you know, in the months following the conflict. We had those national staff picking up kind of the banner of humanitarian assistance and saying, I want to do something, I want to continue to work, I want to continue to be there on the front lines as we're working with these populations. And we had to deal with new areas, aside from our quote unquote normal work, if humanitarian assistance is normal work, that we needed to adapt to. So training in areas of mass atrocities, right? And mass civilian casualties. We also had to reinforce areas of and surge capacity to respond to outbreaks of disease. And a major issue, not only for International Medical Corps, but for the entire humanitarian community, was accessing basic resources and supplies, which was completely cut off. But I'm happy to say, in working with the Chadian government and working with those in the field, we've managed to successfully create a corridor to get services into the country since the greater part of this year, and hopefully beyond. And, you know, to your second question, Rebecca, on the spillover in the region, I think what's most concerning when these conflicts erupt, particularly when we're looking at spillover into countries that are already considered fragile states. And what I mean by fragile state is, you know, political turmoil already exists. There are socioeconomic inequities. And whereas we, you know, International Medical Corps is the most concerned is the state of the health infrastructure, the health resources that are already strained and now must contend with this new influx of individuals that are crossing over to the border that need assistance now. They can't wait. So we see these individuals crossing at high rates who have diverse health histories, right? And so the lack of resources, the lack of health personnel, the absence of health facilities, little or no access to water or food, and then virtually no protection against violence. All of these are elements that come into play as we're seeking to respond to those needs. And so far, you know, International Medical Corps in Sudan, we're serving 64 health facilities that are accessed to more than 2.7 million people. And these are delivering integrated health services, nutrition, protection, mental health, and psychosocial support, which I think cannot be understated when you have these types of conflicts. And of course, access to wash and water services. So we'll continue to look at that burden. And then across the Sahel, as I mentioned, we'll continue to have to anticipate further disruptions when it comes to working with individuals that are in most need.
Right. I mean, and you mentioned how a number of the countries in the region are at low economic status, but yet now are bearing the burden of this influx of refugees. How do we support those communities and those people as well, right? Because you don't want to neglect the citizens of that country that are under such strain when an influx of refugees come in. So talk a little bit about our approach to that.
Yeah, absolutely. I mean, it's a great point, and that's one of the areas where hostilities can easily erupt when you have influxes of different people who are under dire need access to resources. But again, as we mentioned, they're going into areas that have already been either neglected by their host government for decades. They're already under strain, and the economic ability to take care of basic needs is already very, very low. I'll take an example of what's happening in Chad right now. We have an influx of Sudanese refugees that are in Chad, and we have these refugee camps that have been set up, and we're helping to move populations where they can access basic services. But what's very important is that we work with the communities, we work with those host populations to be a part of this relief structure, and at the same time offer services to host populations who we recognize are also going to face challenges and being part of being indirectly or directly impacted by the needs that now arise. Providing opportunities for employment or training in our staff, being those who are access points, persons of responsibility, things like that, or being part of the design and thoughtful implementation of the projects that we will then implement are all parts of the strategy that we adopt when we have these types of situations, and really working with them to, even when it comes down to the physical location of some of the sites, where those access points might have to be diverted in order to make sure that the host population has what it needs. All of these things are things that International Medical Corps does to ensure that we're working with the community alongside the community.
Well, as we're kind of moving west across the globe, let's talk a little bit about the United States, Erica, and the incredible hurricane season that we just went through. I think International Medical Corps responded to 6 major hurricanes across the US, Puerto Rico, and Jamaica this past year. It was an incredibly busy season. Maybe you can summarize a little bit about our responses there, but is this something that we should expect every year? Is this the new normal?
Thanks so much, and thanks for having me here today. And while I can't predict the strength and severity of the hurricane season, yes, it is the new normal. I think what we do know is that the number, strength, and severity of these storms and other similar crises, whether they're disease outbreaks or other climate-driven events, are going to continue to get worse in their magnitude and worse in greater in their impact on the communities that they hit. This hurricane season, we did respond to 6 storms, all the way from Texas all the way up to Hurricanes Helene and Milton in Florida and North Carolina. And I think what is really striking about what we saw, in addition to sort of the massive area that was affected in the number of communities, is this kind of a link between the infrastructure and people's health and healthcare. And I think what we're seeing in the United States and what is becoming clear is that the challenges that individuals and families face accessing healthcare after a crisis here in the United States are exactly the same, while the context might be different, exactly the same as the challenges people face anywhere else in the world. And so after Hurricane Beryl hit Texas, people were without power for several weeks, and a massive heat wave came in. And we actually saw that more people lost their lives as a result of power loss and heat than had been affected, specifically by the storm itself. In Asheville, around North Carolina, it got a lot of attention in news. But what we saw is, there were communities that were without clean drinking water for nearly 2 months. For 53 days, people in the United States, in Asheville, North Carolina, did not have access to clean drinking water. And so what International Medical Corps in that instance had to do is the same thing we do everywhere else in the world, which is figure out how to truck in clean water. And for us, really partner with community health clinics to make sure that they could reopen their doors. They had the source of clean water so that they could provide care to their patients. A lot of what we do in the United States is work directly with community health clinics. And we do this because they serve the most underserved populations, those individuals who are on Medicare and Medicaid. And 10% of Americans, 30 million people, use them for their regular care. And so when their doors close, and Paula, you know, when you're talking about resilience of communities, when those doors close, people can't get access to healthcare. The exact same things, like Dr. Abdu was saying, around you know, chronic diseases like asthma and heart disease, but also, you know, if they need urgent care, those things are not available. But also, they're economic drivers in some of these small communities. If their doors are closed, people can't go to work, and there's lost wages. And so, you know, it's really incredibly important for us that we're there and we're able to do what we do everywhere else, which is fill in gaps, helps bolster the healthcare system at a time of crisis. We also do work with state and federal responders in these kinds of cases to be able to provide that kind of care, but really ensure that we can protect communities from the dangers of the repetitive impact of loss. When these communities get hit time and time and time again, it becomes harder for them to rebuild and to recover. And so again, just like Dr. Abdu was saying, you know, our medium-term solution is to build that capacity. And sort of after the early days that an emergency happens, we look forward to how can we provide training to community clinics, to the, you know, the first line doctors and nurses on the ground who are often thrust into being first responders. You know, how can we help them be better prepared, whether it's a climate-driven crisis, which we are going to see more of, or another disruption in their community. And really work with them on things like business continuity and infectious disease outbreak response and maintaining power and water, you know, at a time where it may be affected. And it's all of this learning from the past 40 years across the organization that we're now able to bring here into the United States and work, you know, hand in hand with communities to make sure that those who are most at risk continue to get the healthcare that they need and deserve.
I mean, when you talk about the U.S. response system, you often talk about how it's focused on, it's not necessarily a health response. Maybe you could
Sure.
give us a little bit of that background and why International Medical Corps is needed.
Yep. Sure, absolutely. Yes. So the U.S. Emergency Response System and its great partners like that we've all heard of, you know, FEMA and the American Red Cross and a lot of the organizations are focused almost, well, not almost, primarily on ensuring food, water, and shelter for those that are affected. And for a long time, it's been assumed that hospitals, you know, would be able to sort of take on the burden of providing kind of urgent care or urgent healthcare needs while the community was recovering. But I think what we're seeing is because the strength and severity of these crises are greater, those hospitals are quickly becoming overwhelmed. They're losing power themselves. They're not able, you know, their frontline health workers are also affected by the crises. And so you have people calling out of work. And so they're not able to do that. And so there is this gap often in the days and weeks following a response where the healthcare system is incredibly strained as the health workers themselves are trying to respond and needs are growing because the community just can't get back online as fast as we used to in the past because power is out and water is out. And that is where International Medical Corps can come in and be a really good partner. Just like everywhere else, we're not trying to come in and replace or set up a secondary system. We're really in there to support the healthcare system and get it back online as quickly as possible in any way that we can.
That's great. I mean, all three of you have done a really great job in kind of laying out International Medical Corps' approach and our strategy for responding. And so, you know, we looked a little bit back over the past year. Let's talk about next year and sort of what you're, you know, keeping your eye on for 2025. I mean, Dr. Abdu, do you want to start? I mean, are there any new crises that you see on the horizon? What are you keeping your eye on?
What we have as a forecast of some of potential crises, we have emerging diseases that are quite regular now. We are even seeing currently in DRC, they are reporting now for 11-day an unknown disease that is causing an outbreak there, and that is coming on top of the outbreak of mpox that was there. So we are trying to focus for next year to build the capacity of community in DRC, Cameroon, and elsewhere to prevent for outbreaks, but also to be ready to respond to those outbreaks. And that is one of our major focus for next year. I think You know, Rebecca, that some of these countries that have been affected by crisis after crisis for long have weaker health system that is not able to even identify or respond quickly to certain of these disease. And the International Medical Corps stand with them, building their capacity to be able to respond to them, but also prevent them whenever possible, and avoid the spread to other countries that have similar challenge. But also, we keep also our focus on the Middle East. We have a lot of crisis there, and with a lot of displacement, returnees, refugees, and all the health, nutrition, wash, and protection related issues that they are facing. We want to keep our focus on addressing their immediate need that they have, but also trying as much as we can to build their resilience and build back their capacity to live better lives as well.
What do you think, Paula? What are some of the things that you're keeping an eye on?
Yeah, I think we're all going to be singing lines of a similar tune as we go into this, because I completely agree with everything that Dr. Abdu said. And you know, we're gonna coin this phrase here, the 3 C's. So everybody who's online right now know that International Medical Corps coined this new terminology, the 3 C's. Which is the intersection of conflict, climate, and communicable disease. And I need to add non-communicable diseases to that too, because when we look at issues like extreme heat that are coming on, that will have an adverse effect on non-communicable diseases, anything that's related to heart conditions or diabetes or mental health. So you know, that 3 C's is going to be really, really important. I think, you know, we've always dealt with conflict. We've dealt with communicable disease. Now we're coming online for climate. It's the 3 of those together that we have a lot of uncertainty around how that's really going to evolve. What's sure about that is that we're dealing in a context that has much more limited financial support, and where the scales of the conflict and disasters are larger. It's going to be difficult to prioritize in that sense of where we put our focus. So that's why I think that the model that International Medical Corps has in building resilience at the community level is so important, because this is going to really be where we can withstand or where we can respond very quickly to these uncertainties. So we're really keeping an eye on that whole intersection, but we're also keeping focused on the model that has stood the test of time again and again, to really ensure that individuals can overcome in these types of circumstances, and where we can build and support will be there.
Erica, what are you thinking? What are you keeping your eye on?
But I guess just to echo my colleagues, right, it really is around sort of building resilience at the community level, you know, as Paula just said, and it's a real focus for us in the U.S. over the next year. And so as communities come out of this hurricane season, certainly, but also, you know, we're launching a large scale project in California to look at the resiliency of healthcare centers. We're being asked to do this by state governments, state partners, and local communities. And it really is around how do we build this resiliency at the community level. So whether it's a climate crisis of any type, whether it's an infectious disease outbreak, whether it's an increase of another kind of need or crisis in a community, the health facilities and the health system there can continue to remain open and operational. And what it's going to take for investments in order to do that, and how we can partner at a local level to do that. And we're working in communities that are as small as 500 people in the Delta region of the United States, you know, to Los Angeles and the surrounding area. So what is that going to look like, and what is that going to take, and how can we help those health facilities stay open, stay operational, and get people the health and mental health care that they need?
Well, we have a series of questions in the chat that really are all kind of related to shrinking financial resources, which you alluded to, Paula, but increasing need, and how International Medical Corps is trying to adapt and advocate and continue to advocate for some of these countries that maybe the funding levels may be decreasing, like Ethiopia or places like South Sudan, where it's a struggle to continue to provide those services. I mean, I don't know, Paula, you and the team, you kind of grapple with this, doing more with less kind of every day. Maybe you could talk a little bit about some of our strategies to do that.
Yeah, it's a great question. I got to just see the series of questions, and it's always in my heart, because in working with a region like West Central Southern Africa, and also working with East Africa, North Africa, this is something that we struggle with all the time. We are contending for media spots that don't always exist to shine a light on this. We're contending for resources that don't always exist. I think the subjective nature of how people perceive how efforts are being done in the continent, or how resources are being used or not used. And so when you have this, I guess, perfect storm of issues that really do not attract the level of support, it's very, very difficult. I think one of the strategies always is that we're advocating on different platforms all the time. We're looking for media partners. We're looking for partners that help us tell the story. We're engaging with maybe some non-traditional actors that also would allow us to have a little bit of, to shed light on these types of issues. And I think that what's really important is, even with what we would call our core donors, or the donors that you normally look to in supporting this type of financial crisis, I think advocacy is still important. We still have to talk about what we can do. We still have to talk about how we're adapting and looking at the new needs. We still have to be doing that, but in total, like, that's really our strategy. And I think our teams at the field level are always looking for ways in which the community can take a hand in that, and show us opportunities that we might not have looked at before. So International Medical Corps is not afraid of looking at the same thing in different ways. We're constantly looking at ways that we can do things differently, do things more effectively, and I don't think that's going to change. So it's just a matter of us remaining active and present.
Well, an important part of building resilience at the community level is strengthening national and community-based actors.
Absolutely.
Erica, your team has a number of projects that are built around strengthening that capacity at the national and community level. Maybe you could kind of talk a little bit about how that's an element of what we're trying to do to make the resources go as far as possible.
Sure. No, absolutely. Thank you so much. And yeah, so, I mean, very true to International Medical Corps' mission. In addition to working with within the health system specifically, we also have a body and a portfolio of work where we work with local organizations who may or may not be involved in healthcare, but are often the ones that are the first responders on the ground, to help them understand what we call the humanitarian architecture, right? How it all works when there is a disaster or an infectious disease outbreak or a displacement, and how to be involved and participate in that, and what capacities they need. And so whether that's just orienting them to that structure itself, providing sort of operational capacity building. How do they better manage their financial systems? How do they align their own policies and procedures with what is expected, among sort of the humanitarian response, so that they are eligible for funding, and so that they have the capacity to be able to respond. And then technical assistance as well. We've recently launched a program that's looking at building the technical capacity of 80 organizations across 14 countries to be able to better participate in infectious disease response. And so by providing that capacity at the local level, we are building resilience. We are putting those tools in the hands of local actors and helping to strengthen, from the community up, the ability of this whole sector to be able to respond to local crises and be able to do that better and faster. One of the things I think we're increasingly seeing because of this confluence of conflict and communicable disease and climate is that we're seeing what had been considered sort of relatively stable places or countries that were having sort of economic growth, have these pockets of deep humanitarian crisis because there's a displacement crisis, there's an infectious disease outbreak that's highly localized. And so by investing in kind of these local organizations and doing that in a very targeted way, we're able to build that resilience within a broader system.
Well, that's a super positive message. But I guess just as we're kind of wrapping up and want to be respectful of everyone's time, I did want to end on sort of what is positive in your view, and what are you looking forward to in 2025? Erica, do you want to kind of build on that and talk a little bit about what keeps you going?
Yeah, it's the response from within the communities we work in themselves. I can speak certainly firsthand from our response to Hurricane Helene. Not only did we deploy 47 volunteers from across the United States to provide medical and mental health care, but we had volunteers from North Carolina themselves, some of who had been affected by the crisis itself, some of whom came from other parts of the state, who were willing and eager and wanting to go in and help their community members, help their community rebuild, and felt passionate about that. And in anywhere that we're seeing that, anywhere I've ever seen it at International Medical Corps, if communities have that kind of passion for their own recovery and resilience, how can we not be there? And that is the most hopeful thing I think that many of us find in this work, is that we're really there to kind of stand with individuals and communities that are doing this hard work every single day.
Well said. Dr. Abdu, what gives you hope in 2025?
In addition to what give hope to Erica, which also apply to me as well, I think the support that we receive from donor community is a beacon of hope by itself. Knowing that there are generous individuals, organizations out there ready to stand with us means we never feel alone in this mission of humanitarian. And it's this partnership that kind of fuel our resilience and optimism to continue doing the work we are doing. So to all of you in the donor community, thank you on behalf of all my colleagues. Thank you so much. Your support is what make us. Your support is what make it possible for us to change lives, and for that we are truly grateful.
Very nice. What about you, Paula?
How can I follow my very eloquent and inspiring colleagues? At the risk of being corny, but I don't care. You know me by now. I feel it. I feel it inside of myself. When we talk about humanitarian work, it's the human in humanitarian that needs to be accentuated always. And the fact that we continue to invest in people, despite the challenges, despite what happens, people continue to look for ways to help people, and people continue to look for hope. And there's a real magic, and there's real magic in that. And I think that that's what continues to fill me with the desire to keep this work going. It's all the people, the donors. Even if you're not financially providing, you're also providing space. You're holding space for us to continue to talk about this. You're posting, reposting on social media. You're talking to friends. You're holding space for the people that we serve and their hopes and aspirations to be elevated. And I think that, people will keep on helping people, and I'm excited for that.
That's really wonderful. Thank you so much for joining us. And thank you everyone that joined the call today. As Dr. Abdu said, we couldn't do our work without you. And so we're very grateful for your incredible support. And we look forward to keeping up our work in 2025 and look forward to seeing you all on the next briefing in the new year. So happy holidays, happy new year, everyone. Thank you so much for joining us. Bye.